What's going on, everybody? Welcome to Anatomy Applied episode number 1, where I'm going to be giving you the knowledge that you need to begin optimizing your health and your performance. Today, we are going to be talking about the psoas major muscle, which to me is arguably one of the most important muscles in your body to make sure that you take care of. So you can see here, it attaches the upper body to the lower body. And then if we begin to rotate to the side, you can see that its main function is to act as a hip flexor. So it's going to bring your knee up past 90 degrees, which is important for exercises such as running, squatting, lunging, and pretty much every kind of athletic movement that you can think of. It also helps us to stabilize the hip joint within the acetabulum, which is the hip socket. That's important because it allows us to be able to transfer force from our upper body to our lower body and allow the two to kind of work in unison with each other. If we zoom in to get a closer look and fade away the other muscles, you can see that the psoas originates on the lumbar vertebra, specifically on the transverse processes, which are the lateral sides. It passes over top the hip joint and then attaches onto the medial or inside part of the top of your femur. If this muscle is chronically tight or weak due to these attachment points, it may contribute to lower back pain because it begins to pull on your pelvis and put you into a position of posterior pelvic tilt, which creates a lot of instability within the front part of your hip capsule. It may also lead to sciatic issues as well as restriction or clicking in the front portion of the hip socket due to there not being enough room for the femur to rotate freely within the acetabulum. So this ultimately can lead to poor mechanics and result in ankle and knee pain. It also explains how this muscle could impact your posture and your spine health. We have to understand that everything in the kinetic chain either flows downstream or upstream. So if your psoas is tight or weak, it may lead to further compensations and cause wear and tear or overuse injuries in other parts of your body. If I begin to add in the nervous system, you can see how many nerve innervations originate near this muscle. These nerves go off to innervate other muscles in the lower body, as well as our organs. Due to the proximity, the psoas major muscle can affect the nervous system. It tightens up and reacts to fight or flight responses, leading to prolonged stress and anxiety. Excessive tension creates a general inability to enter into the parasympathetic state of the nervous system, which is responsible for rest and relaxation and digestion. So you can see how it would negatively impede your recovery from your training, from your sports, from your activity. The psoas truly is a performance muscle, and if it is dysfunctional, it's going to cause dysfunction throughout the rest of your body. So now if I begin to add all these organs into the picture, you can see how the psoas is vitally integrated within the posterior abdominal wall. Excessive psoas tension can also contribute to digestive issues. The psoas creates a bowl shape for our organs to sit within. The nervous system is constantly receiving and transmitting signals to and from the muscles as well as the organs. It's able to detect any inflammation or excessive tension, and then it sends out the signals and responds accordingly. If we fade away the organs, you can see that the psoas major muscle is in close proximity to the diaphragm. It just sits within the thoracic aperture, which is the opening that your rib cage creates. So if there's tension within the psoas, it's going to affect your ability to breathe and expand your diaphragm and get the oxygen into the lower lobes of your lungs. If respiratory status is affected, it prevents us from fully being able to oxygenate our tissues, which leads to more sympathetic nervous system dysfunction and stress, as well as a decrease in our overall endurance and output during athletic movements. Some things that commonly cause psoas tension and weakness are excessive sitting, poor squatting and lifting mechanics, chronically sleeping in a flexed hip position, the general imbalance within our day-to-day activities, or due to the demands of your sport and competition. I'm going to show you how to use the 3RSP system to effectively rehab, release, reactivate, strengthen the muscle, then use that muscle to perform optimally. So the first stretch we're going to be doing is the standing hip flexor stretch. You really want to make sure that you have full extension in your back leg and you try to reach as far forward in the lunge as you can as you twist and open your rib cage up towards the ceiling. Remember, keep pushing into that front hip. Next up, we are going to be using the Right, which is a tool that is going to really be able to get deep into the tissue and begin to break up some of the adhesions and the tension within the psoas. So you're going to place it about 1 to 2 inches between your belly button and the top of your hip bone. So you're just going to sit in a comfortable position. Your goal is to be able to stay there for about 2 minutes to create more of a plastic or permanent change within the length and the tension of that muscle. To isolate it further, you can specifically put it on one side at a time to give you more of a trigger point release. So just stay there and get comfortable. You can also move around just to help facilitate some of the breaking up of the muscle fibers. If you don't have a Psoas, in addition, we can floss using a kettlebell. You just place it in that same position in between your hip, and you begin to flex your knee towards your chest. Okay, so make sure that you're really pulling and trying to create as much tension as possible, and then you can do the same thing with a straight leg, and that will really get into the psoas and help it to release. We can also make this a little bit more challenging by attaching a band so that we have continuous tension, and on the way back it is actually creating traction within the joint and helping us to get more space within the hip capsule so that we can rotate freely without all that snapping or clicking. Okay, next we are going to be going into some activation exercises. So we're going to be doing a lift off. The key here is to drive your knee as hard as you can up towards the ceiling while flexing your feet as well and really pulling from your hip flexors. Now the psoas is most active in hip flexion past that 90-degree angle, so you're going to want to hold for 5 to 10 seconds. Next, what we can do is help to facilitate that even more by pulling with our leg, trying to get our knee into our chest, and then actively using our hips to keep our knee up in that upright position and try to increase our strength in those end ranges, and this will carry over to the bottom of your squat position. Also, you can try various different articulations of your femur, so experiment with this one. And again, you want to be holding this position for as long as you can, trying to create as much tension as possible throughout your entire body while you stand there. Next up, we are going to start getting into some more of strength-based exercises. We're going to be doing the psoas march. Okay, so the key here, you're going to lay down flat, push your back into the ground, and then we're going to extend our hips up towards the ceiling and actively drive our knee towards our chest, pulling from our hips, flexing our toes as hard as we can, and holding in that end range position for 1 to 2 seconds before coming back slow and controlled. And this is a great way to isolate and strengthen your psoas muscle. Again, if you want to make this a little bit more dynamic and difficult, we can change the loading by putting ourselves on a box, and that's going to further increase the demands of some of the other muscles in our posterior chain, such as the hamstrings and the glutes. So this is a very key exercise and a staple for rehab, reactivation, as well as overall strengthening of the psoas muscle. Lastly, one of my favorite exercises is going to be the dynamic eccentric overload hip flexor lift off. So what we're going to do is get into a plank, shoulders over top of elbows, and then we're going to drop our hips down towards the ground, and then extend up and push away and really crunch and pull our rib cage down. You're going to feel this through the front portion of your hip, and this will allow you to create a lot of strength through all of the hip extensors. Okay, and hopefully that will alleviate a lot of the popping and clicking in conjunction with the release and the new space that you're going to create in the joint. So thank you everybody for watching episode number 1. Let me know what muscles you would like me to cover next.